In this video, I discuss my testosterone replacement therapy with my new doctor for the very first time. We discuss how I came to be on testosterone and what my life was like before being diagnosed with hypogonadism back in 2012. We talk about how my treatment started, the way that it was administered, how it impacted me, how my life changed, what worked, what didn't work, and everything in between leading up to today in 2023, finding a new doctor and being committed to trying to be a little more on top of my therapy, my blood work, and my overall health when it comes to this treatment. I've been on it forever, and I have become relatively complacent over the last couple of years. So this is a really, really exciting opportunity to start from scratch, see where we are at, assess, reassess, change modalities of treatment if needed, as we will discuss in this video, and open up a better dialogue about how to safely be on TRT, how to manage your health on TRT, and how to be responsible and efficacious about administering hormone replacement therapy.
Let's kind of talk more about the TRT and your whole kind of like primary care picture. So you've been on TRT for how long?
2012 when I was diagnosed with hypogonadism.
Okay. What's your experience been with testosterone?
Oh, it saved my life.
Yeah.
When I was in a treatment-resistant depression and on a bunch of psych meds over the course of like a year and a couple of months. They were trying to figure out what was wrong with me. I had a paradoxical reaction to Vivitrol.
Oh, okay.
Naltrexone being the active ingredient, and spiraled me into the worst black tar depression, anxiety, suicidal ideations, depersonalization, derealization. Wow. It was really, really brutal. And over the course of like 12 to 15 months, they just started trying treatments. Different cocktails of psych meds and mood stabilizers and antipsychotics. And then I watched one of those anti-aging men infomercials in the middle of the night. I moved back here with my parents at the time for caretaking, and I got the idea that maybe that could be it. I just didn't know what was going on.
Yeah.
I was frail. I was like weak. I was flaccid. Got blood work and came back 155 nanograms per deciliter for my total. I think my free was like 3. I think it was
just barely there.
Just barely there.
Yeah.
And then they thought it was weird and they didn't actually buy it. So they had me do 3 or 4 more blood draws. I think the highest one was like 204. But it hung right in that range. They started treating me. It took a while to figure out how, my primary had never prescribed before. So he didn't know what he was doing. And I say that respectfully.
Totally.
Sure what
if it's out of your wheelhouse, you just don't know.
He put me on 400 milligrams every 2 weeks.
Yeah, well, that's like classic what they used to do. And did you have to go into the office and get the injection? Yeah. So it's cool.
It was just the 400. In hindsight, it's like that is an absurd
drop in the bucket.
An absurd amount to give someone once every 2 weeks.
Yeah. So you get these huge peaks,
massive
and big long valleys.
Yeah, but to make it like a short form, long story, it took a while to learn enough about it, to get my own education and support, to find out that I probably should get my dosing more frequent. And it eventually got me to every 3 to 4 days. I typically do Monday and Friday, and I do 0.4 cc's.
Okay.
That has been as low as 0.3, but it hasn't been anywhere near 200 milligrams in a long time. So 160 milligrams a week is what I've been on, split into 2 doses of testosterone cypionate. I just alternate the outer quadrant of my thigh.
Are you feeling pretty good on it?
Oh yeah, I feel pretty good on it. I wonder if I want to be optimized, obviously, and I want to be healthy. I have no interest in being what the average man out here is. Most people look sick and unwell. That said, I want to be healthy. I want to be appropriate with it.
Yeah.
I wonder if my free T is maybe higher than it needs to be.
Yeah.
I'm not sure.
Or vice versa. Sometimes men will have like totally optimized looking total T, and then their free T that's actually like bioavailable is bound up because they have high sex hormone binding globulin, which comes along with being metabolically healthy, right? Metabolically unhealthy people tend to have lower sex hormone binding globulin, which is very interesting.
That is very interesting.
Yeah, so a lot of these hormone docs will be like really targeting a decrease in sex hormone binding globulin to free up more T.
Yeah.
But we actually see that having a high sex hormone binding globulin is more metabolically and cardiovascularly healthy.
Interesting.
Yeah, so it's this kind of like tricky thing, but ultimately it's like you dose the testosterone higher.
Yeah.
Instead of messing with the BG.
Nice.
Yeah.
So yeah, that has been in a good place, minus the fact that I haven't had blood work for a long time. Last time I had it, it seemed like it was okay.
Okay.
But I just want to make sure that
Yeah.
I'm being, I guess, responsible.
Yeah.
With all that stuff. But I've been on it forever. I don't know if I would have had a chance to get out of that depression without it. I was able to eventually get off all the psych meds because of it. I was hungry for the first time in like a year.
Wow.
I was able to blah, blah, blah. All the normal stuff.
Yeah.
But I was over-medicated, I think, at 200 milligrams. 160 seems to be a sweet spot, but...
Okay. And, you know, when it comes to TRT, managing symptoms and kind of paying attention to how you feel with the dosing is a lot of times more important than
the abject
the
numbers.
labs.
Got
Yeah,
it.
exactly. Sometimes we'll get men up into the like 1200s or something, and they actually lose erectile function with it.
Interesting.
Yeah, so it's really like individual.
Yeah.
And so it's kind of like making sure that your levels are to a point where we feel like we're doing a good job to prevent, you know, cardiovascular issues and like practice good preventative medicine,
Right.
but also making sure that you're just feeling your best with it.
Awesome.
Yeah. Are you happy with the injectables or?
Yeah.
Okay. Another thing that you could think about in the future would be pellets. Have you ever heard of?
I've heard of that. They're
testosterone
like
pellets?
transdermal, is that what they call it?
Yeah, they're transdermal pellets. They're quite small. We just do a simple office procedure, implant them into the subcutaneous fat, usually on your butt or on your flank. And you need the procedure, but every 4 or 5 months. You might need it every 4 months since you're super active. The benefit of doing subdermal pellets is that it's released at a more physiologic dose, meaning that it corresponds to cardiac output. So the way that your body works with creating endogenous testosterone is if you increase your cardiac output, the gonads are supposed to make more testosterone to help fuel your muscles and engage in muscle recovery, joint lubrication, all of these things. So with the pellets, because they're implanted subdermally and you get more blood flow to the area with increased cardiac output, they dissolve faster. So there's just a more normal physiologic rhythm with it, which is really nice.
Yeah.
It's very low maintenance, and men just seem to feel really good on it. So that's always an option for you too.
I'll definitely explore that. I'd love to explore that.
Yeah.
I just haven't thought about it, I guess.
Yeah.
I've just been doing the same thing for a decade.
Yeah, right.
Yeah.
Well, just another option for you. I think first step is probably going to be just getting back your blood work, seeing kind of where you're at, and then we can talk about whether if we want to continue with injections or explore pellets. Go from there.
Cool.
Okay.
Awesome.
So what you want to do for your labs, though, I want you to get your labs drawn on the day of an injection, but before you take the injection.
My trough day.
Mm-hmm.
When do testosterone levels typically peak? 48 hours post injection when it's cypionate? Do you happen to know? It's okay if you don't, of course.
I don't know exactly.
Yeah.
I would think 24 to 48.
Yeah, that's where my head sort of goes to.
Because that's why we do twice weekly. Because I would say 24 actually, because you actually do start tapering off. You still get peaks and valleys with the injections.
Yeah.
Yeah.
Yeah, I was always encouraged to, well, injections were encouraged because it was, compared to topical, I was just instructed that it was a guarantee. This is how much you have. This is how much is going in.
Injections are definitely
we
superior.
can just make sure that whatever is happening or not happening, we can adjust because we know what it was.
Yeah.
I started on, I forget what it's called, but one of the pumps.
Yeah, like a cream.
Yes, it was like a foamy thing. I forget what it was called. It's been forever. It was really expensive.
Yeah.
But it was simple but a nuisance at the same time.
Yeah, and then like dermal fatigue is a real thing where the skin, if you apply something to the skin for a long period of time or even a short period of time for some people, the skin's like, nope, we're not absorbing that anymore for some reason.
Never heard that before.
Yeah, it's really common. So that's one of the reasons that I don't really care so much for the creams, and it's just easier. We get better levels with these alternative options.
Cool.
Yeah.
All right.
Okay, so we'll do that.
Cool.
Okay, well, let me get everything typed up and ready for you. And then we'll get you out of here.
Thank you. I really appreciate it.
Yeah, absolutely. It's so good to meet you.
Oh, so good to meet you. I wanted you guys to have a chance to see me interact with this new doctor for the very first time, essentially in the raw. We will be discussing very soon in future videos the results of upcoming blood draws and how we might modify and adjust my testosterone based on how I'm feeling and what the labs say.